What if I told you that a mother chest is more than just a source of comfort? It's an inbuilt incubator, a natural painkiller, even a life saving intervention. Today, we dive deep into science of Kangaroo Mother Care, KMC, a practice backed by decades of research that has transformed neonatal care worldwide. Meet Geta Rasciuc, a pioneering expert in baby wearing and neonatal care with over 18 years of experience. As a founder of Exo Neonatal and the Hugs and Kisses project, she has revolutionized soft textile carriers for Kangaroo Care. A board member of International Board of Baby Wearing Consultancy School, Jetta collaborates globally to support early childhood care, influence policy, and reduce infant mortality. How are you, Jetta?
Really good to see you here.
Yeah, same. We waited for some time, and I'm really excited to meet you. And when we were planning our meeting, and when I was reading the research, I was really surprised. Even though we are medical healthcare, especially delivering babies, and we should be the one who should be educating this all. After reading this all science, I was really surprised.
Yeah, well, actually, this is surprising for me as well, and it's surprising for many years. Because I come from the parent side, from the patient side.
Exactly.
I'm not a medical professional.
Yeah.
I'm an educator. And what happened is how I got into the whole kangaroo care space is that I was invited to a neonatal unit in a hospital to help a mother with a low birth weight baby to wrap her baby.
Right.
And I came there, and I already knew because I was reading research. I'm not a medical professional, right? So I need to have my evidence information, and this was in 2010 or 11.
Yeah.
So a while ago. So I knew that there were guidelines for kangaroo care on the World Health Organization websites. There was research happening in different countries all over the world. So for me, it was just logical to think that mothers and neonatal units use this practice because whatever research you read, even 10 years ago, it was mind-blowing to see the effects of just the contact between the mother and the baby. So I come to this neonatal unit, and I'm showing the mother how to wrap her baby.
Right.
And I'm showing this, and there were two nurses, and they passed by, and they stopped, and they were looking at me. And they said, oh, this is the kangaroo thing we got to learn in our continuous education session. So I'm like, oh, can you stop? Let's have a conversation. So we started talking, and I asked them, how come if you are trained in kangaroo care as a nurse, as a neonatal nurse,
why you're not
why aren't you doing this? Why did this mother had to invite me? And they said, well, we have the guidelines, and it says just wrap the baby in a blanket, put it skin to skin, but there's no specific. And me coming from the baby wearing side of things, world, let's say, it's literally the expertise of holding the baby, redistributing its weight, positioning it correctly. So we already had the tools. It just needed to come a moment where the nurses can apply their knowledge with the correct tools. And the baby wearing world could bring its knowledge and skill into the clinical world. And finally, we're coming to that point after many years of work and research. And I'm very excited about this.
Yeah.
Because the benefits are major, mind-blowingly major.
Exactly.
So it's not just my belief, because we did the project I told you about in Ukraine. And we brought together the Association of Neonatologists and the Association of Baby-Wearing Educators there. And they started working together to implement kangaroo care in a new way. And after several months, the neonatologists said, wow, okay, we need to collaborate more. And now this summer, they signed the memorandum of collaboration. Now they're doing education sequences together. So it's kind of bringing together two worlds, two bodies of knowledge together to implement and to help all the mothers and all the babies even more.
So when we were deciding the podcast, and I was just thinking that maybe it's just a product to be sold. And then I wanted to know more about, and I started doing my research, and I was surprised that this is solid science, and tools are there. They're not being used, as you said. So everybody knows, but probably they're so overwhelmed with the big other things, and something which is so easily accessible and something which is really, really useful we are not using. So let's start for our patient and for our audience. What are the advantages and what is the science behind this Kangaroo Mother Care or skin to skin? So it's a mother's chest. It's an inbuilt thermostat, like their temperature control. It's amazing. And we were talking about some studies of the twin.
Yeah,
So let's talk about it.
There's a lot of research. So first of all, the Kangaroo Care practice, just for the audience to understand what we're talking about, means that when a premature baby is born, they have trouble thermoregulating. They have trouble adapting their heartbeat. They have trouble adapting their breathing rhythm. So their system needs to mature in order to be able to thermoregulate autonomously, separately, outside of the mother's body. And in the 70s, a doctor in Colombia, they had really high infant mortality rates for premature babies. So the probability of the baby surviving was really, really low. And the legend says it, that the doctor was... so there was a patient who had a premature baby, and the baby was separate, and the mother was crying in the corridor. And the doctor thought, this baby will die anyway. And I might as well give the baby to the mother so that she can just have the last moments with the baby that she carried for all of these months inside of her. And just let her have the moments together before the baby passes. So he takes the baby from the incubator, the premature, tiny, tiny baby, and gives it to the mother. And the mother just holds it and keeps crying, and they just spend there hours and hours and hours, and the baby doesn't die, and the baby doesn't die. And then all of a sudden, baby survives. And
Wow.
the doctor notices this, and then he thought, oh, there's something there. So he started removing babies from incubators and giving them to the mothers.
Yeah.
And the babies would survive.
Wow.
Because being in close contact with the mother's body is our biological norm.
And biological incubator, which is
Exactly.
better.
So after years of research, when the World Health Organization started recommending Kangaroo Care, the main reason for recommendation was thermoregulation, because this was one of the first things that was scientifically demonstrated, is that if you put the baby on the mother's body, the baby will copy the mother's body temperature of 36.6.
Amazing.
And hypothermia risk goes down a whole lot.
And there was some twin study also,
Yeah,
you were
and there
telling.
is also a very interesting study. One of the key researchers in the field, Niels Bergman, he is Swedish, but he does his work in South Africa, if I'm not mistaken. They did a study. I was at a conference in 2016, and they did the presentation. And it was amazing because they were showing chromatic photography, where they would put newborns, prematures, skin to skin on mothers and on fathers.
Right.
And on the fathers, the baby's temperature would rise, so they would not get into hypothermia, which is important because hypothermia is one of the key causes for infant mortality. But on the mother, what was interesting and I think breakthrough sort of thing is that the baby's temperature would regulate. So it wouldn't just go up. It would also go down if it's too high.
Wow.
So if the baby has a fever, but you can see this also with mothers with children born at term, at home when the baby is teething, there is this like instinctual thing, like I'll just hold my baby and the temperature will go down.
Right.
So on the mother's body, the baby's
regulation.
temperature doesn't just go up, it thermoregulates.
Right.
And the conclusion of the researchers who did that study with the chromatic photography is that the breasts of the mother have a key role in thermoregulation.
Amazing.
So it's not just for feeding the baby, but it's also for providing them with the
It's
right
a medical
temperature.
intervention. It's not just the bonding.
Yeah, exactly.
And I was reading some twin study that there were two babies on different breasts, and their temperature was being regulated, and even the both breasts had different temperatures.
Yeah, because
amazing.
It's called co-regulation. So in the mother-baby dyad, it's not just the baby, it's the mother's body who's providing the model to mirror, not exactly to copy, but rather to mirror for the baby. But both bodies in this connection, in this dyad,
Yeah.
just like in pregnancy, further along for the coming months, they co-regulate. So the baby's body also regulates the mother's body to the point where it helps produce milk. It helps because the mother's body feels the baby's weight, feels the baby's skin on herself. So her hormone system starts reacting and responding to the needs of the baby and adapting to the needs of the baby. And if you're looking at the twins that you mentioned, it adapts to both babies
Differently.
and or even because there are cases where the mother is pregnant but still has another small child.
Yeah.
So the mother's body also assigns resources by the needs of both children that she is nurturing,
Amazing, yeah.
which is huge. So
yeah.
we have
And we'll be putting the reference of all those things, all these studies for people reference also in the description so people can read about it. Then there was another research I came across. Skin to skin reduces the crying 10 times.
there's
So,
crying. Well, having a newborn baby, especially when you're a first-time mother, is stressful because you don't know
Exactly.
how to manage it, and it comes with all the like, oh my God, it's a new world. And of course, when the baby is crying and you don't know how to respond, the mothers get extra stressed. But because of the co-regulation that we were just talking about, and because of the close proximity when the baby is just here, the distance is so short that the mother can react to the baby's needs immediately. So even before the baby makes one noise, the baby, when it needs something, it will start moving in a certain way or making some little noises or start grabbing or doing the latch reflex, just opening their mouth and pulling towards the breast. So the mother can react to the baby's need immediately, right when it happens, before letting it develop into a bigger thing.
Yeah.
And because of that, when you address the need right away, the baby doesn't have any need to cry.
Exactly.
And
also oxytocin release because it's a pleasure hormone.
Exactly.
So it might be, counteracting the cortisol.
Well, it's
which
both
is,
ways.
Exactly.
Actually, because we're doing this project in the war zone, it's also just the fact that the babies are not separated from the mothers. It's reducing majorly the stress responses of the mothers because they are in a terrifying situation. They're in terrifying circumstances. So their cortisol is high. But because of the skin to skin, because they have the feeling of security of having their babies close, they get more calm, they get more oxytocin, and so does the baby. So their response is much more calm.
Yeah.
So of course it's.
I think even beside war zone, because war
it's
zone is
not just war zone.
I feel the new generation, when I talk to my patients and being expat in Dubai, so also they need a lot of support. So even it will be right in that context also when expats are alone, their family support is in their countries. So, this could be really relevant for them also, having a skin to skin, decreasing some stress because they all are anxious, what's coming, there's not much of the
There
support.
was a study that also said, aside from babies crying less, there is a study that also said that it decreases incidence of postpartum depression.
Amazing.
Hugely. And that's exactly because of the oxytocin.
Exactly.
Because you feel the proximity, it lowers anxiety majorly.
Pleasure hormones come. And also in the fathers, it decreases the postpartum depression also because now we hear that postpartum depression is also something fathers can be having. So having a skin to skin, maybe thermoregulation might not be that smart, but it's
it's still working because it's helping the baby avoid hypothermia. So that's, the fathers are very important to get involved. And while the mother can can nurse the newborn, the father doesn't have that option.
Exactly.
So actually holding the baby skin to skin for the father also helps release oxytocin. And which is a bonding hormone. And they build that relationship on a biological level, not on a talking, social level, but on a physical level. Skin to skin with the father is literally a key for them to bond with their child and to
also
build bigger bonds in
and decrease their
attachment.
stress.
And decrease stress, of course.
So officially, we are recommending right now, and it is backed
Yeah.
by science, that fathers also can go ahead with the skin to skin. So then there's a concept of golden hours and breastfeeding success. And within this first 60 minutes, if baby is on the mom, there's a breast crawl, and even the feed production is more. So let's talk about that.
Yeah, it's actually amazing. It's amazing how powerful nature is, that she has put in everything that a mother and a baby needs. It's already there. We have it.
Yeah.
So in a natural environment, when the baby comes, the first thing that the mother would do is would hold it.
Yeah.
And we'll let it, even if you put about the breast crawl, right? I'm sure you have experience with that, where you put the baby on the chest of the mother, but it will crawl, even though it
Towards the nipple.
towards the nipple, and will latch on to nurture themselves. It's just the powerful instincts that our human body has already programmed in. But as the golden hour, again, the birth itself, labor and delivery, it's a huge labor. It's a lot of work for the mother's body.
Exactly.
But it's also a big hurricane of hormones, right?
Exactly.
You have all the oxytocin that's needed for the labor and delivery, but also oxytocin is contributing to prolactin release and to getting the milk to prepare to come out and feed the baby. But again, if the baby is allowed to crawl and start stimulate the breast of the mother's body starts... Again, we were talking about co-regulation, right? So they are regulating each other. And if you're separating them at the beginning, you're sort of depriving the bodies of the mother and of the baby of this co-regulation mechanism.
It's especially important in the first 60 minutes.
Yeah, exactly.
Yeah. You know, yesterday when I just delivered one baby, I put it skin to skin, and baby was a little blood stained because of the delivery, even the father touching and blood in his hand. But I could see the pleasure. They were not taking care of this old blood and stuff. The pleasure, and they even took picture of that moment, because that moment was so precious, and their
it gives
faces,
them the release.
like,
Yeah, I can imagine.
And she didn't take any painkiller, no epidural, nothing, no analgesics, but they were so happy. So I could see the power of oxytocin in the father, in the mother. Baby was so well. Even though it was IUGR baby, by the way, at 37 plus weeks, it was 2.38 kilo, and that was the reason we did kind of induction of labor. And baby delivered normal. But the thing, the baby didn't needed any support.
Yeah.
Baby just went to the mom, even being IUGR.
Yeah,
So
the World Health Organization in 2023, they released their new guidelines for skin-to-skin care. And in that guideline, there are 3 approaches that they are recommending globally to be implemented. And the first one is immediate skin-to-skin care, is continuous skin-to-skin care, so uninterrupted, and community-based skin-to-skin care, which means that the first thing that you do when the baby is delivered, you give it skin-to-skin immediately, even if you need interventions. There are researchers, there are studies in Sweden, but not only in Sweden, in different countries, where they do even clinical interventions. If the baby is delivered and needs an intervention, they do it skin to skin. They do it on the mother's body, because it allows the stress levels to go down. It's even where the skin to skin is even used as a painkiller in a way.
yeah.
Because of the contact and the hormone cocktail that is in the body of the mother and the baby allows them to support the interventions even lighter. And there is research that's talking about pain relief as well.
Yeah.
So we can talk about that
Now
too.
I'm about to talk that. But, you know, like, I just realized that for this, like, even intervention being done on the chest, hospital staff has to be trained.
Yeah, exactly.
They should know the importance. We should highlight about this. Even the management and the policy makers, everybody should be educating that only then this step is possible.
No, of course.
Yeah.
This is not something you do just
Exactly,
because
out
you
of
read
the
something
blue.
on the internet.
Exactly. It has
but
to be on bigger
it's really
scale.
nice to see that there is practice implemented in other countries, And it's a huge gateway for hospitals to exchange skills and to do training together and to take the best practices from other countries and implement them there when you see that there is good results.
Exactly.
And there are huge results.
Especially now, birth and process is getting people like more natural. They don't want interventions. They want it to be more closer to the nature. So our next point, which we just were talking, you were hinting a bit, skin to skin is a natural painkiller. So of course, we have a scientific proof about that also. So let's talk about this point.
Well, again, it's related to the fact that both the mother and the baby are more relaxed and they are in a good hormonal state for getting less stress, I guess. And even I know a researcher who is working with newborns who are born with withdrawal syndrome from addicted mothers.
Yeah.
And they deal with a lot of pain as well. And she was doing studies on how their pain response was happening because they have to deal with a lot of that in contact and in separation. And in contact, the babies would cope a lot better, even with that syndrome. But aside from special cases like that, there's research that shows for the prick test, where the baby...
Or intramuscular injections.
We were talking about getting the intervention done in skin to skin on the mother's body. So they put the baby on the mother's body, do the prick test, and the pain response is a lot lower.
That's amazing. Yeah, I was reading, there are Cochrane reviews also, and they prove this. And we know Cochrane reviews are the good studies. So let's talk about strengthening the baby's immune system, because the microbiome baby take from mom's skin and even getting the good microbiome in the gut. So let's talk about this.
This is amazing also. I before even reading research, I was working with a neonatologist back in the days. And she was recommending skin-to-skin care and baby wearing for a long time. And she was the one who pointed me to this immune strengthening part. And it was right at the beginning of the conversations about the microbiota and whatever. And she said, it's just that every family has its own microbiome. Because when you live in the same family, in the same house, you get colonized with your strand of bacteria and microflora. And once the baby is skin to skin on the chest, not on washed cloth, it gets the exact
same microbiome.
The same microbiome as the family is coming into. And
that's amazing because they have the same genetic and the same colonization. I mean, they must be in the harmony.
And then they are in harmony, but they are also getting stronger. You're not putting them in a vacuum, in a bubble somewhere, but you're actually letting their body adjust to the
houses they're about to go, to the family. So then very important time, Kangaroo Mother Care versus Incubator. So if babies are put incubator, Kangaroo Mother Care decreases the mortality 40%. Because, I was talking about the Kangaroo Mother Care in front of one patient, and she said, are you sure this will be, because we have incubators, we don't need Kangaroo Mother Care. And I just thought about that is there a comparison? And then I come across this research which says that mortality will be decreased by 40% versus incubator.
Well, let's look at it from this perspective, right? The incubators are really a life-saving tool, and there are babies who will not survive if they're not there, which is absolutely normal. There are decades of practice using incubators. At the same time, if you look at the research of places, low resource locations, high resource locations, you see massive amounts of evidence showing that the physical contact is a huge contributing factor to decreasing infant mortality. And not just mortality, because in skin to skin, when the baby is separated in a box, they have the thermal care, the temperature, the everything else, but in skin to skin, it also has the heartbeat of the mother. It feels the rhythm of her breathing. It feels well, if the mother is walking, it feels familiar rhythms from her steps. Again, not all the skin-to-skin care can be done in mobility, but that's another part.
Exactly.
But the baby is exposed not only to the environment that will help it survive, but it will also be exposed to rhythms in skin-to-skin that are familiar to them. Rhythms that are important for them to regulate as well, like we talked in the beginning, because the babies in skin-to-skin, there's also research aside from thermoregulation. In skin-to-skin, babies' heartbeats stabilize faster because they also copy the mother's heartbeat.
Yeah, exactly.
So you get less arrhythmia. They copy the mother's breathing rhythm, so they have less what's it called?
Even hypoglycemia is less.
Yeah.
What I
So
read.
there are
So
so many
many.
more
It's a
elements
package.
to that environment
Yeah.
on the mother's breast,
Yeah.
comparing to in separation, that are contributing. And actually, I did a study for our project where we compared skin-to-skin care in traditional carriers in Tanzania, and we compared them to a more modern infant positioning device. And because the mothers felt more comfortable in the carriers that we were checking, they would do more hours of skin-to-skin care. And before the 2023 new WHO guidelines, there was no specific, like how much skin-to-skin a family should do per day, how many hours. And you could look and find some research that would say like, you get amazing effect if the baby gets at least 3 hours per day. But still in many countries, they barely do. Like, yeah, we did 1 hour per day of skin-to-skin. But once you get the 3 hours, and that's what we saw in our study, you get such an amazing effect that the babies in our study group would gain 150 grams in 2 weeks more than the babies in the control group, who are also receiving skin-to-skin care. So the extent, the how many hours per day of skin-to-skin care the baby receives impacts on how fast they gain weight.
Wow.
And fast weight gain allows for faster hospital release.
Exactly.
And we got, one of our results was that the babies could stay even 1 week less in the neonatal unit.
Amazing.
Just because they had more hours per day of skin contact.
Amazing. Now, my favorite part, and I think most of the moms in Dubai's favorite part, the babies who receive KMC or Kangaroo Mother Care, they have a higher IQ, higher emotional intelligence, better social interactions, less depression and anxiety, and they are the one who earn higher income. If I tell this to my patients, I'm sure everybody will go for it. Yeah.
I will tell you a little story from my practice as a baby wearing consultant, because I've trained like literally thousands of parents in 18 years. And I'm in touch with a lot of them. And it's so interesting because you mentioned social development.
Exactly.
And emotional development. So we were talking about skin to skin in newborns, right? But actually you can wear your baby from newborn until the baby tells you, "Mom, thank you, bye."
Yeah.
Well, that's what happened with my son. He was around 2 years old, and
Yeah.
I didn't wear him much, but I would just wrap him on my back to put him to sleep for his nap.
Nice.
And he was around 2, and I said, "Come on, let's go sleep." And he sees me and he says, "No, I go sleep alone in my bed," and he ran away from me. And since then I never wore him.
Yeah.
But he felt that he was done. So
Wow.
actually there is something like it's a phenomena. It's called touch hunger. Because people that don't get enough physical contact, they feel the need for it. Like there was the whole free hugs movement a few years ago, and there was research that was saying that if you do a 20-second hug, then you get the oxytocin release, and 4 hugs per day allow you to be more relaxed and whatnot. So coming back to the story with emotional development. So the first 6 months until the baby gets really heavy, you can wear them in the front. The position is called heart to heart.
Okay.
Which is a beautiful name for it. And you wear it heart to heart, and the mother can like go do her thing. But what happens in this position, I can show it with the doll later, is that while the mother is doing her own routines, the baby sees the mother, sees the face of the mother all the time, interacting with the world. So he learns how to react to things from seeing the mother being involved and active.
Amazing.
And newborns, they don't have muscle control, right? So by the time they are 3 months-ish, they start learning to use their facial muscles. And I have seen this many times where a baby born from birth in contact face-to-face with the mother or with the father or with the nanny or whoever else, they will start copying the facial expressions they see on the adult.
Nice.
So they exactly mirror. And I had some families where the mother would go to work and the father would wear the baby more.
Wow.
And he would smile like on a side. And the daughter at 3 months, she just became a complete copy of her father.
Wow.
Because, and it was amazing to see because you literally see. So the first thing they would copy would be your heartbeat and your breathing rhythm. Then the next thing is they copy your facial expressions.
So they become
Then
emotion reader very early.
Then later they copy your tone of
Voice.
your talking.
Yeah.
They don't talk yet, but they record. They are close with you, so they start talking like you talk. They just make noises like you do.
Amazing.
And then after the baby gets heavier, you don't wear it that much anymore. You still have your back to take care of. But for bigger babies, it's recommended to, if they still need that physical contact, you can wear them on your back. And when you're on the back, they still hear your heartbeat because their ear is there. But they can see
from the side.
Their eye level is at the level of an adult. They don't see the world from the knees and looking up. But they look at the faces of other people. So
and in a way, they're interacting. Their mother is interacting.
Yeah. So like I said, in the first months, they look at the mother interacting with the world. But if you start wearing them, but up high on the back so that they can see over the shoulder.
And they might be having
learn
feeling.
how the world is interacting with them. Plus, because the mother starts integrating them, going out with friends, doing whatever she wants, the baby grows being comfortable in the society that he's in. So of course he's doing less tantrums.
Eye contact is very important thing to learn. Sometimes I'm talking to mom and the child is on their lap, and I'm talking to mom and child is behaving as if I'm talking to him. They're nodding, and it's so funny that I start looking at them and I start talking to them. But that I always comment to the parents that your child is a listener. They have eye contact as if I'm communicating to them. So really it explains a lot. Now, the very important thing you talk about, that KMC is very important in the conflict zone and low resource setting. So let's have a few words about that.
Well, again, the conflict zone project that I mentioned, the one in Ukraine, it's actually one that kind of happened to my project, to what I'm doing. Because there was the war started in Ukraine, and there was Canadian neonatologist Douglas Macmillan, who has decades of experience specifically in Kangaroo Mother Care. So it was his initiative, and he came with the idea that in the hospitals there, they can't rely on electricity supply. They can't rely on medical equipment if there's not enough electricity. And the winter is coming, and he thought that a Kangaroo Care intervention would be helpful in those settings. So then we started with a small pilot. We talked with the Institute of Neonatology in Ukraine. Tatiana Znamenska is the director of that. She's also a neonatologist with experience with Kangaroo Care since the 90s.
Amazing.
And this was very interesting because she has been training with Colombian researchers. So she has a huge knowledge, huge experience on that, but they never got to use baby carriers to do the skin-to-skin care. They used other tools. So we delivered the first package of baby carriers to them. We trained the nurses. And then one of the feedback points we got from one of the directors of the perinatal center, he said, when you're protecting babies, my conclusion now is you can't have enough carriers like you can't have enough bullets. Because the mothers, when they have a carrier that holds the baby securely, then they are not bound to the bed. They are not separated from the baby, so they feel secure. And if there's a strike alarm, you need to react immediately and run to shelter. And when she has it close to her heart. She can run to shelter and know that she's
Exactly.
not separated.
Yeah.
But also we had another director saying, I am telling all of this and I get chills because it's
Yeah.
really horrible to even think that this is happening, but this is the life we're in. And when we can help a baby, we're helping the next generation.
Exactly.
Not just the today people, we're helping today and 10 years from now, 12,
Yeah.
20 years from now. So there was the other director of a perinatal center who said that they have mothers that come for labor and delivery to their perinatal center. And when they have to do discharge, they don't have a house anymore because it was destroyed by a bomb.
my.
And he says, now the carrier and skin to skin becomes the first home of the baby.
Exactly.
Because that family becomes a refugee family. They need to
Yeah.
commute and find another place to
My,
stay. But because they have access to holding the baby close,
Amazing.
it diminishes their anxiety. It gives them the knowledge that they are safe, the baby is safe, they can go to shelter, they can.
We really cannot imagine
It's
what's
unimaginable even for me.
happening in the world, but it feels like that this is a good intervention there.
Yeah, but even for high income, like high resource locations, like skin to skin is a biological norm for the human body.
Human has instinct for it for millions of years.
Exactly, because if you think about it, the separation practices, according to some sources, they started being implemented after the Second World War for newborns and prematures, because that's when the hygiene norms were introduced and everything needed to be disinfected, which is great and saved a lot of lives. But in the sphere of maternity,
It
was
went wrong.
The good intention that went a bit too far.
Exactly.
So it dismissed a lot of the biological needs for contact
Yeah.
in favor of disinfection.
Yeah.
But again, since the studies in Kangaroo Mother Care started in the 70s, we have more than 50 years of research demonstrating the value of this. And now we're coming back to what's actually right and reasonable for us. And I think this is a huge step in getting to our norm. And it's also interesting because I was talking to a researcher who is studying thermoregulation in the Netherlands, and he was studying thermoregulation in penguins on attachment. It's really interesting. It's really cool. And he was telling me a very interesting point. He said that, well, this is logical, right? The human baby is not autonomous. It's not like a baby horse that can start walking immediately.
Yeah.
So the human baby starts walking on their own when their brain volume doubles in size from their volume at birth.
Yeah.
So and funny enough, there is also research that shows that a baby in contact, their brain develops in 1 week, as in separation in 3 weeks.
Oh.
So again, the baby needs the contact in order to get ripe, to get their brain to develop at the right level, to get independent and self-sufficient at the right pace.
Amazing.
And when we're separating them, we're slowing down the space.
Yeah. And this all is solid science. So I think after having this whole conversation, everybody will recognize or realize how important it is. It's more important in the preemies or the premature infants or the low birth weight infants. Let's talk about that.
Well, of course, most of the research is done with premature and low birth weight infants.
Yeah.
Because they are the critical mass, the critical babies that need the most help, the most interventions, most support to get them to thrive. And because all of the Kangaroo Care practices, they started with premature babies. They keep going with premature babies. And even the recommendation is for
As
prematures.
we're comparing with the incubator.
Yeah.
So mostly incubators were used for the low birth weight or the prematures. Amazing. So I think we should have a quick recap of the benefits again, because it's very important, because all the moms listening there, they should understand. So let's talk about the short-term benefits.
I will do a little bit of a different move here, because the benefit list is so massive. It's even hard to put it together, and we could spend 2 hours just talking about benefits. So what I prefer to do is to do a category, like the three major categories of benefits would be the physical benefits, the psychological benefits, the social benefits, both for the mom and for the baby. So now we can make 6 lists of different benefits.
Yeah.
But again, and then we can make another set of lists for the whole family and the whole community.
They all can have the Kangaroo Mother Care.
Every single group
Awesome.
of people is impacted. It's not just the baby. It's not just the mothers. It's not just the nurses. Because
Fathers, grandparents,
family, grandparents, siblings, every single element of the community benefits from implementing skin-to-skin kangaroo care.
Yeah.
And this is the amazing thing. Again, like going back to my Ukraine project, we had reports from hospitals where they say, once we implement kangaroo care in contact, and again, the recommendation is at least 8 hours per day now, which is a lot, and it's not easy to implement. But once they implement it, the mothers get involved in caring for their babies, even though they are stressed from prematurity, they are stressed from all the new environment, stressed from having a new baby. They get to bond with the baby faster. They get involved with caring for the baby. And then the clinical staff is freed and available to take care of emergencies. And the hospitals are moving and shifting their practice towards a more family-centered care and getting the family more involved. And that's where we talked about the fathers or the grandmothers or whoever else is inside that family who can be the support group for the baby.
Amazing. Long-term health benefits for the KMC?
Oh, well, you mentioned that Cochrane review,
exactly.
Which reviewed thousands of other research papers. And like again, the list is massive. But also, we didn't mention this part, but for older children, just this heart-to-heart position, the kangaroo position evolution for an older child, it helps prevent hip dysplasia.
Wow, nice.
There is actually the Hip Dysplasia Institute in the US, and they recommend holding the baby upright with the hips in spread squat position, where the knee is above the butt of the baby. And just this position in proximity allows for the baby's hip joint to develop in a healthy way. And then you're avoiding surgeries, you're avoiding a lot of other problems.
Yeah.
But again, hip dysplasia, that's only one drop in the bucket. It's a huge bucket of benefits.
Exactly, yeah.
So I'm just now thinking, how long will we stay if I start listing benefits, right?
Exactly, yeah. We already talk about the mental health and the bonding with the babies, not just for mom, but also for the whole family. So are there any unexpected benefits of the Kangaroo Mother Care which you discovered over the years?
Well, the unexpected part for me, like the most impactful, was the part with the war, of course. But I can tell you another story where I was at the Kangaroo Care Congress. Well, I went to several. And at one of them, one of the Kangaroo Care researchers was telling me about how they used skin-to-skin care to resuscitate a mother who went into a coma after birth.
Oh, yeah. You were telling me that.
And like, it's mind-blowing because her mind was not online, not available, because she was in a coma.
Yeah.
And the doctor's teams couldn't resuscitate it. The baby was there separate in the incubator. And then Susan Ludington, I think it was, who told me this, she said, like, we need to give her the baby. We need to give her the baby. So she went and took the baby out and put it on the mother's chest. And it wasn't a conscious thing. It was a biological body thing where the mother's body reacted to the baby, started generating the right hormones and brought her back.
Wow.
And like, this is the power. And also they resuscitate babies just like this in physical contact, and it's efficient. And there are studies about that just as well. Yeah.
So resuscitation benefit for both mother and the baby.
Again, well, we talked about the co-regulation.
Yeah.
It's a dyad. It's both of them together.
Yeah. So let's talk about the implementation. If hospitals just come forward to implement, so what would be the key components needed for successful KMC implementation in the hospitals or communities?
Let's put it this way. The World Health Organization has a full guideline with
Yeah.
every single step that needs to be taken, with all the procedures and protocols. They have the guideline and they have the strategy for implementation that I mentioned earlier. So there is that part. The other thing is that like every single hospital or home care, family-centered setup will have their own ways of managing the mothers and the babies. So, of course, everything needs to be adapted locally and specifically to that unit. But again, the guideline that I'm mentioning, it says now that every premature born low birth weight baby needs to receive at least 8 hours of skin to skin per day, minimum 8
That's
hours. How do you do that? Because if we think back historically, the research on Kangaroo Care started decades ago. Then 2003, the World Health Organization first time published their guidelines on Kangaroo Care that weren't as specific as they are today. They started recommending. But in 2016, if I'm not mistaken, there was a prematurity report. And I know this because I was looking into that, and this was what puzzled me and made me go into the whole Kangaroo Care sphere more in depth. And I was looking at the report, and they listed all the interventions for premature babies on how to ensure better outcomes, help the babies thrive. And Kangaroo Care was on the list. And then implementation rate was 7%. So by 2016, the world already knew, the World Health Organization was recommending it. Nurses were trained in their continuous education studies. So there is a lot of knowledge.
Yeah.
But
no
aside from
implementation.
knowledge, you always need to transfer knowledge into skill
Exactly.
and then to implement.
Practical.
So I think we are now at the moment in time where we have a massive body of research that proves that this is not just good and beneficial, but it's also important. And now there are tools available to help implement, to help the nurses, to help the clinical staff, to help the mothers. And it's a complex game. Of course, there need to be more information. So maybe train in perinatal classes. Mothers need to be aware that they have this option up front. Clinicians need to be trained and be able to pass the information on to the mothers. Even mothers need to go and demand it because maybe the
Exactly.
hospital doesn't
I think
know.
mothers are really into it, but I think my next question actually would be that what are the challenges faced by you when you're scaling up KMC programs?
Well, usually, so far, what we've done, there was initial clashing because I told in the beginning, I come from a baby-wearing world. I'm not a medical professional.
So, Geta, can you just demonstrate us how it is done?
Okay, I will not do the demo skin to skin because we're in a public
Yeah.
place, so I'm not getting undressed. But I'll show you how we use one of our carriers, infant positioning tools, how we use them for getting the baby on the
Right.
mother.
Do you need some help?
So maybe I'll move away the microphone for a bit.
Sure.
And then I have everything else around me.
Perfect.
So here we go.
Yeah. I'll be
take
doing
off
the running commentary.
Yeah, you can do that.
Yeah.
So, well, I have several, but
Even if I like the packaging, the way.
well, it needs to be as compact and easy to use.
Yeah,
as
exactly.
possible.
It
You need
looks-
functionality.
Exactly.
There is also, it's easy to complicate things, but to
Yeah.
make them simple, it's not an easy task.
And
we
making
spent,
simple is important for
we
mothers.
spent years in developing and making the carrier as functional, but at the same time as simple as possible for mothers and for nurses and for everyone else.
Yeah. Baby is really cute. Anybody can see that. It's 4 kgs.
Yeah, it's a real baby. I'll shout out my colleague Marloes,
Yeah.
who has this technique to make it even easier and faster. So if you buckle one side, you already get a shortcut.
Yeah.
And because we're sitting down, so I put the baby on the opposite shoulder and let them slide in.
Wow. Looks comfy.
Full on. So I need to make sure that the top edge of the carrier goes to the
Back of the neck.
back of the neck and the top of the ear of the baby.
Yeah.
And then we do the other strap. I hope I did it. I don't see what I'm doing. So
No, it's
excuse
doing
me for a bit.
And it's better while you're standing.
Well, again, you can adapt.
Yeah.
And everyone does their own thing. Okay, no, it's just that I don't see what I'm doing now on camera. Ah, there we go. I knew that something was not right. Now I fixed it.
Yeah.
Now, then we buckle the other one. There we
That's
go.
amazing.
And the thing is, so buckle up.
And you said something that baby should be kissable.
Yeah. I'll tell
And
you about the
visible.
safety rules because there are safety
Yeah.
rules here. First of all, what I'm doing now, because the baby is buckled on,
Yeah.
but it's wobbly, right?
Yeah.
So I can even put a whole apple in between us.
Right.
But because we're talking about babies that don't have muscle control, right? So we need to make sure that it has good support on the shoulder line, not here. It
Is there
shouldn't
any
be sitting.
recommendation for the distance between the baby and you, like what should fit in?
It should be close.
It should be close. Nothing should fit in.
Yeah. So here I put it close enough. So now I will tighten the carrier and then I'll tell. There is the kangaroo position. And this doll is a bit bigger, so I'm not showing the kangaroo position. I'm showing the baby wearing position because it's a 1-month-old term baby.
Yeah.
That's the demo doll that I could bring. So nonetheless, when the baby doesn't have muscle control, we make sure that we provide
Properly hugging.
proper support. The baby in a carrier should be like you would hold it in your arms,
Yeah.
but with your arms free.
Yeah.
So now I tighten this side and I tighten the other side.
They should be as close as you do it with the hand
Yeah,
while you're holding
exactly.
the baby. Okay.
And
It should be kissable.
the visible and kissable rule.
Yeah.
See, I need to be able to kiss the top of the head of the baby at all times.
This makes
if the
sure it's the
baby,
correct position.
because the baby then is definitely in between the breasts with their ear on my heart.
Yeah.
And they're feeling all they need not to feel. They have the right connection spot. I'm not shifting my center of gravity to dislocate my
Exactly.
to strain my
Lumbar
back.
lordosis and something,
So
yeah.
we need to make sure of that. Then another majorly important thing in positioning a baby like that is to make sure that 2 fingers can fit between the chin and the chest of the baby for a
Right.
bigger baby, because we don't want to restrict their airflow.
Yeah.
Because their neck is much shorter than with an adult, and you don't want to give them hypoxia. So you need, again, having the baby visible, which means having their face visible all the time, kissable. You can always react, control, and make sure that the baby is in a safe position. Then there is the hip support part that we were talking about, the hip dysplasia,
Exactly. Yeah.
when the baby's hips are in an M position, or
Yeah.
for very small newborns, there's the frog leg Kangaroo Care position. Again, there are some debates in baby wearing world in this regard, but we're talking about practicality, right?
Yeah.
So you need to make sure that the hips are under a correct angle. And this way, you just have the baby here. You can have
Nice,
your
nice.
sip of
You know,
water.
my son is
but you're
17
caring
years
for the
old
baby.
and 16 years old, but I feel like I go back in time and do that. Yeah.
Yeah.
Yeah. We have a little ritual for She's Well, so all these discussions should go on. And you brought so much information to our space. I hope everybody will avail that. So you will lit the candle, and this
Oh.
candle should show how much light you brought to our space.
Oh,
Yeah.
thank you so much. I'm really
you.
excited to be part of your
Amazing.
podcast. It
I
was
also
an
enjoyed-
honor to be invited, and it's a double honor to do the candle lighting. Ah, come on, light up.
I felt for some while.
Ah, come on. Yeah, I think it's there.
It's done. And there's some small souvenir which will remind you anywhere you go.
Aw.
It's a small thanks.
Oh, thank you so much. I really appreciate it.
We will look it there.
Yeah. Thank you.